Thank you for joining me today. My name is Samir Damani. I'm a practicing cardiologist, a researcher, and the founder and CEO of MD Revolution. And today I'm going to tell you about the two most powerful predictors of chronic disease, in particular cancer and heart disease. VO2 is one of them. V is consumption. O2 is oxygen. It's our ability to consume oxygen. It's the level of our fitness. Here you see that high-risk people that are low fit, as represented in the blue line, have a high risk of death when followed over 30 years. If you take the same high-risk people, and this study was done at the Cooper Center, 11,000 men had their fitness levels measured by a treadmill test. You take those same high-risk people, but you make them high-fit, and you cut their risk of death in half. There's very few therapies today that we use in medicine that even cut your risk for anything by a quarter, much less a half. Looking specifically at the reduction, this was an 18% reduction in death. So one of the commonly used concepts in medicine is the number needed to treat. You take the absolute risk reduction, divide it into 100, and that tells you the number of people that you would need to treat with an intervention to prevent an outcome. In this case, we would need to take a high-risk person who would be a diabetic, an obese, heart disease patient, take them from low fit to high fit, only 5 of them to prevent 1 death. Contrast that to the most commonly used therapy in the world, the use of statins for people with high cholesterol. We have to treat 85 people to prevent 1 death. So you can understand why VO2 is such an important parameter that heretofore we ignored in our reactive, disease-centric approach in medicine. The next thing we need to be thinking about is visceral fat. Visceral fat is the fat that is sequestered around your organs. It's very different than subcutaneous fat, which is removed by liposuction. This fat is not dormant, it's metabolically active. It produces hormones that drive insulin resistance, diabetes, cancer, plaque rupture in heart attack patients. And it can be easily reduced through methods like interval training, improving your VO2, improving muscle mass, and intake of certain foods that tend to be more metabolically favorable, low glycemic index foods. And this is important because we're finding that obesity by itself is a poor predictor of chronic disease. In fact, there's a concept called the obesity paradox that is widely used now and known, where individuals who are obese and diabetic actually have lower mortality rates than those that are thin. Same for obese individuals with coronary disease or heart failure. Those on dialysis actually tend to do better. It's quite remarkable. But what we're finding is that these individuals that appear to be obese and metabolically unhealthy are actually healthy because they don't sequester their fat around their viscera. So in the blue, those individuals that are obese by BMI are actually metabolically healthy because they are not sequestering the fat. They have more of a pear-shaped body, while the individuals in the red who might have a normal BMI are much higher risk because they are sequestering visceral fat in that compartment, and they tend to also have lower levels of fitness, and these are also individuals who tend to perform more poorly. And so what we're doing at MD Revolution is we're actually taking technology, everyday technology, consumer technology like activity trackers. We're encouraging our participants in the program to log their meals through various apps. They're using heart rate monitors to get their heart rate up to higher levels in interval train, so that way they're able to improve their VO2. And what we're seeing is, you can see in the scientific reproduction, that the blue shaded area, which represents 50% of people, and if you follow all the way out to the vertical line, that represents 75% of the population studied, all of the individuals are tracking in the right direction, whether it's reductions in visceral fat or improvements in VO2. You're seeing a trend that goes together. And so what this shows is that if you use technology in the right way, if it's deployed in the right way, you can move the most critical risk factors known today. And there are no side effects to this. So that idea is that we need to start using this and deploying this to populations in a much more efficient fashion. And that's what we're doing at MD Revolution. Thank you.